Hey everyone, it's Jeff. Happy Monday. I hope you all have been doing well. I just moved into my townhouse for school now, and so I get to be back up here for getting ready for that stuff. And today we're going to be talking about bottom surgery and whether or not we want bottom surgery, the different procedures that there are right now, what those would entail, and how to deal with bottom dysphoria. So here we go. I'm first going to be talking about the difference between metoidioplasty, I'm going to call it meta because I don't know if I'm pronouncing it correctly anyway, or phalloplasty, which I'm going to call phallo, because again, they're difficult terms. I'm not a doctor, I'm not specialized in anything like that, and I think that those are very difficult words to kind of say anyways. Meta is the surgery in which it takes the anatomy that you already have and kind of enlarges that, whereas phallo is something that's taking a skin graft from like your arm, from your abdomen, from the side of your chest, from your butt. I really think that it depends on what surgeon that you're going with based on how large that you want the result to be, as well as to which area of the body or from another person that you get that skin from to make the phalloplasty work, to make your penis, basically like an implant sort of thing. Between the two, meta is definitely going to be smaller than the phallo, because meta is just kind of enlarging what you already have and doing something with that. Some people have been saying that you are able to pass as kind of a micro penis, and that you have the sensation, and you're able to feel what's down there. Whereas phallo, you're less likely to be able to feel anything, but you are a larger penis, essentially, if you choose to have phallo. As for whether or not I want bottom surgery, I'm gonna have to say no. And I don't know if that's because I think it's really because I feel like I have multiple options on how I want to have sex with people. I guess I'm able to get something to use to be able to penetrate someone else if I so choose to do it that way. And, you know, there are things out there that would allow me to have sex without having to go through an invasive surgery that I may not want. I'm extremely sexually inexperienced. I've never even kissed anyone before. So, like, I don't know if that would change once I start wanting to get intimate with someone, but at this point in time, I don't see bottom surgery as something that I'm gravitating towards. And I know a lot of people would say that they're not going towards it because it's not perfected enough, or the results don't look well enough for their specific needs, or it doesn't look realistic enough, which I think, you know, one, the results that people are seeing online, you're being privileged to be able to see such intimate pieces of someone's body that they're showing other people, to show kind of what the procedure is like for another person. And a lot of those pictures are happening when they're still healing. Like, the end result I see would be fairly realistic, at least in my opinion, from what I've seen online and doing the research and that sort of thing. But a lot of people have this misconception that anyone who gets bottom surgery is just going to have a shitty result, and that's not always the case. Of course, there are instances with surgeries that in any surgery, anything can happen. There are things that can be screwed up. It happens, and it's not just going to happen with bottom surgery. So there's that. As for bottom dysphoria and how to deal with that, I'm I'm really not the person to ask. I say this because I'm someone who kind of just disregards what's below my belt quite a bit. I don't know if it's necessarily causing me as much dysphoria as it did before I had top surgery, and I think now that I've been on testosterone for a while, I think I've just sort of gone with the flow of what my body is, and I'm just starting to own in that. But I don't exactly have very many tips on how to deal with bottom dysphoria because I didn't have terrible episodes of bottom dysphoria, but I've never really acknowledged the bottom portion of my body for a long period of time. So my technique is just kind of finding something that you do enjoy doing to kind of put off whatever you're thinking about. And that can be helpful for some people. If you put off something for too long, though, it can pile up, and that can be very, very difficult to deal with later on. But to kind of get your head away from something negative, I would sometimes just go straight to playing my guitar and doing something like that. It was a distraction method, and that seemed to work fairly well. I don't. Am I allowed to say that I don't really masturbate at all? Is that a thing that I can say on YouTube, I guess? I mean, I'm a demisexual, and so I don't really experience a lot of sexual attraction to people that other people who aren't on the ace spectrum would feel. Or let me retract that statement. People who are ace may not feel the same amount of sexual attraction as those who are not ace, if that makes any sense. Of course, I'm not going to generalize what every single person experiences, but I don't have that need, I guess. Of course, yes, there are some instances where I am sexually attracted to someone and I don't really know what to do with myself. But I don't deal with anything below the belt doing any pleasure like that. I don't know. It's just not something that I have ever done growing up either. So, too much information from Jeff this week. It's great. It's fine. I don't know. But, yeah, bottom surgery. Not so much something for me. And that's something that I've known for a while. I just don't see it as something that is completely necessary for me at this point in time. That could change later on, but right now I'm dealing with the body that I have and I feel pretty comfortable with myself. So that's that. There's my take on the topic of bottom surgery and dysphoria and all of those things that they're important to discuss and they're important to talk about. And so, yeah, that's it, I guess. I hope you all have a great week, and I'll see you next week. Bye.